Welcome to the Intersection Podcast. The Intersection is a Robert Wood Johnson Foundation project built for advocates to share how they're partnering to create anti-racist health systems. In recognition of Black Maternal Health Week, we're dropping 2 podcast episodes focused on birth justice. Started 10 years ago by the Black Mamas Matter Alliance Incorporated, the week celebrates the leadership and expertise of Black community-based organizations as a foundation for advancing equity and ensuring transformative, sustainable improvements in Black maternal health. I'm your host, Anton Gunn. Our first episode focuses on disrupting the status quo in healthcare using the lessons from midwifery and birthing centers. We have invited Jenice Fountain from the Yellowhammer Fund, Jennie Joseph from Commonsense Childbirth, and Sonya Shin from Harvard University to discuss what it means to provide safe, respectful, and dignified care that's rooted in choice, cultural knowledge, and lived experience. With that said, let's get started. It's good to be with all of you. I want to start by really getting to know you a little bit more. So if you could start by sharing who you are and a little bit about the work that you do. And I'm going to start with you, Jenice.
Hi, my name is Jenice Fountain, she, her. I am a bit of a writer, very much a wanderer. I'm a community member, a mother, a friend. My folks would call me an activist. And then the work that I do was very much just affirming what I needed when I was a person that needed abortion care, when I was a person that was navigating pregnancy, postpartum. The work that I do currently with our coalition is just building something new that really serves us. And that's in a group where we have physicians that feel disillusioned by the whole do no harm right inside of systems. That's with mutual aid programs that affirm that people know what they need. So just creating new in this landscape, affirming that there's no one coming, right? I think sometimes there's that thought that someone's got to come do the thing, and then having to realize that we are the people that are tasked with doing the thing. So,
Yeah, Sonya, how about you?
Yeah, hi Anton. I'm Sonya Shin. I'm trained as a physician and I'm out here in New Mexico where I take care of patients on Navajo Nation. I'm really interested in implementing community-based programs to get at the heart of health equity. I guess I'd consider myself an implementer at heart. I'm also a researcher. Yeah, excited to be here.
Fantastic. Jennie, how about you? Tell us who you are and a bit about your work.
Yes, I'm Jennie Joseph. I'm a midwife. I've been in the United States since 1989, but I was born and raised in the United Kingdom. My parents came from the West Indies in the 1950s. I do a lot of things, but I center everything I do in making sure that we get the best possible outcome for every person every time. So in midwifery, in my world, that means that mothers, babies, families, communities are thriving. I have a nonprofit organization which will be 30 years old next year. And I have a birthing center in Central Florida. I have what we call the Easy Access Clinics, which are outpatient clinics for anybody who needs care, regardless of whether they can pay or whether they belong, so to speak. And we have a midwifery training school where we train community midwives to serve their communities. And we have what we call the National Perinatal Task Force, which is our movement building body. Across this country, we have 404 perinatal safe spots, like-minded folk on the ground in community, making that difference for the birth outcomes and eradicating racial disparities for Black and Indigenous maternal health in the USA.
Well, fantastic. And that actually is a great segue to what this conversation is about. How can midwifery be a part of the solution for improving the maternal health system? So I wanted to ask the three of you your perspective and opinion on what gets in the way of it being a part of the solution. I'll start with you, Jennie, since you finished your thoughts.
Yeah, what gets in the way is that we don't have midwifery as standard in this country. What gets in the way is people still don't recognize and understand what midwifery is. Everywhere else in the rest of the world, you're going to know that the community knows what a midwife does and why. Midwives are the guardian of normal. They are standing in that gap with every person at every step of the way in the maternity journey. So what's getting in the way here in the USA is that we no longer depend on midwifery like we have done for centuries to manage and support the birthing population. Rather, we've turned it into a crisis, into high risk, and we have folk who are like-minded attending to the maternity care. And that is where much of these outcomes are coming from. It's not because people don't care to do their work and they're doing it to the best of their ability. It's because the system is bereft. It has not got a place or an understanding of person-centered care, keeping respect and dignity front and center, and allowing people to have their bodily autonomy and ability to make their own decisions and to have a voice in their healthcare. So those are those gaps.
Wow. Sonya, how about you?
I completely agree with you, Jenny. I feel like as somebody who works within a healthcare system, there's a lot of pride and sort of like presumptuousness thinking that our healthcare system is benevolent at best when it's really based on a profit-driven system and has not been designed for patients or families at all. I like to think of the positive things, and I'm kind of a solutions-oriented person. I think if healthcare providers like myself, like you were saying, were part of their medical education was to actually understand, to actually go out into the homes with a midwife, to accompany a midwife and understand the value that they have and the sanctity of the relationships that they have with their patients. I do feel like there could be a better solution for everyone because the providers aren't happy either. That's the other piece of it.
Mm-hmm. What would you say, Jenice?
For me, I appreciate what Jenny said about midwifery being a standard. I think where we go wrong is not realizing that midwifery is a dire necessity. It's not an accessory. It's not just a cute project, right? Where we could do better in terms of the workforce is really trying to address the issues as a whole and acknowledge the structural inequities that lead to them. For Alabama Birth Equity Initiative, that has meant that not only are we focusing on individuals that want to become midwives, but also the preceptors that are doing all of these trainings without care, without anywhere to lean for themselves, without the ability to take care of their own families. Some of our preceptors were coming out of pocket, right? So that's money that would have been in their household, but they're very much responsible for the people around them and making sacrifices that they shouldn't have to make. So the initiative is not only is it compensating the midwifery students, but also the preceptors, and then being knowledgeable about what people are up against, because there are preceptors in the state that will not accept Black students. So when we have conversations about what's accessible and what's close, it matters that what's close is actually a place that's deeply anti-Black. It matters that that place is really just mimicking the systems that we're seeking to reform.
The three of you are incredibly impactful in this work in elevating the place of community, elevating the place of changing a system and making it more responsive, anti-racist, and meeting the needs of the community. But here's one thing that I do know is that this work is hard. It doesn't come with a lot of fanfare and a lot of glory. And so I don't think when you're in third grade and your teacher asks you, what did you want to be when you grew up, you didn't say that this is what you wanted to do for a living, but yet you're here holding this space and having an impact. So I really want to know your story, your journey. Why did you choose to do this work? How did you get into this space? What brought you here? So I'm going to start with you, Sonya. I know you're a physician, but all physicians don't do what you do. They aren't at the intersection. They aren't in the basis of a community delivering support and care. So tell me, what brought you into this work?
I guess I would say I was first trained as a community health worker and then later on as a physician. I continue to work with an organization called Partners in Health, which is a global health organization, and spent maybe my second year, like a gap year during med school, doing home visits in Lima, Peru. So for me, it was a little bit strange coming back to medical school and being taught about patient boundaries and things like that, where my understanding of healthcare was like to go into the homes and if they offer you food, you eat it, And so I guess I've always felt like healthcare starts in the home, and that what we do in these like little clinic walls are just such a paltry part of it, and you're kind of kidding yourself as a healthcare provider if you think that you're solving the problem by prescribing, metformin. That said, I still see patients because they are my mentors. They're my role models. Everything I do is grounded in that privileged relationship. But I've just felt like, through it all, how do we actually build these tendrils and these bridges out into the community from within the healthcare system? How can we sort of like raise the bar of accountability? Like, what weight bearing can the healthcare system do to sort of account for the lack of food in the home or the lack of drinking water?
Yeah.
So I think for me, it's just been trying to think in reverse from my experience abroad. It's kind of ironic that coming back to the United States, it's actually harder to build those systems, right? Because we're so entrenched in a colonial structure.
Yeah. Wow. Thank you for sharing. Jenny.
Yeah,
What?
it wasn't quite third grade, but I was called. And I think most of us who are in midwifery, doula work, perinatal types of spaces, somewhere along the line, that's what called us, right? And I was
Yeah.
actually 10 years old. My mom had one of those menopausal oopsie babies. And so I took care of my brother. I just commandeered the baby right out of her arms. And it was like, it's my baby. And that was when I knew, oh, I have to work around babies. Like, this is what I'm here for. It took me till I was 19 to find a midwifery training program in the UK that would take me at less than 20 years old. And I didn't want to be a nurse. I was really kind of contrary. And so they opened up a pilot program in London to see what it would be like to train hospital trained midwives who were not nurses. And I was in that first cohort, and I was also the only graduate. And that's where it started for me. And it has never stopped. I mean, I think, what is it, 45 years in at this point, and I am just as tickled as I was from the day one. I love this work, and it's something that has consumed me, right? And interestingly, I only had one child myself, and he's going to turn 40 tomorrow. And I'm like, oh my goodness, right? Like, this has been our entire lives. He's become a midman, as he used to call himself when he was little, because of that, proximity to the work. And it is because you can feel your way through this kind of work. It's embodied. It's part of our DNA. It's part of who we are. And I know that the calling goes through the ancestral line as well. So
Yeah, fantastic story. A mid-man, I like that word. That's phenomenal. So, Jenice, your personal story, what drove you to this work? How'd you get into this work? And I'm just really interested to hear why you've chosen to have such level of an impact.
A little bit less traditional. I was adopted when I was 7.
Mm.
And I started getting into this work by the time I was 21 when I had my oldest. And for me, I had no language for this work, right? I just knew from a very young age that I felt deeply at odds with everything around me, which Bell Hooks stated beautifully. I always felt at tension with what the norms were around me, how people navigated. I've always felt responsible for the people around me. Care has always been innate. And when I was engaging my own personal issues of like needing abortion access, needing state services that weren't offered, I felt frustrated enough to organize around it. I was like, well, if this is my reality, then it's got to be the reality of other Black women in the state. And what the state really sought to do was really deeply stigmatize reaching out for care. It really stigmatized and inflicted shame. And that was something I wanted to disrupt. So before I had language, I had a lot of frustration. I had a lot of care. And then staying in the work now, just for me, it's so necessary to move past theory. We have to do more than grieve. Like, I can't only grieve. I've grieved out. We have to avenge, right? So a lot of our work is because I think we have to do something about the harms that we've had to face. I've really struggled to not want blood for what has happened to Black women in this country. And I'm very much in this work because I feel responsible to avenge what has happened, regardless of what that looks like.
Yeah, that's phenomenal and powerful. So crystal clear that this is more of a calling than anything else. Jenny, you laid that word to bear that this is who you've always been. And I think most of us can understand and connect with that. So speaking of that, this is who you've always been. I really like to think about the younger versions of yourself. So the 21-year-old Jenice, the 19-year-old Jenny, the brand new community health worker of Sonya, who is really just getting started in this work. What advice would you give to the younger version of self, just getting started in midwifery, advocacy? What are some pieces of advice you would give to them? I'm going to start with you, Jenny, and then go to you, Sonya, and then Jenice.
yeah, stay humble. Just back off a minute, like zip it. The humility that is needed to be able to be open every single time. That's why we made our tagline at Commonsense Childbirth, every person, every time. That encompasses everybody then, right? But not putting yourself in the center because you don't belong there, right? Move out so that there's room for that client, that patient, that person to be centered authentically and wholly and holistically every single time. That's what I would think would be the best possible way you could get going and stay in the work.
Very good. Thank you. Sonya, how about you?
I guess my advice would be to be in a community, really take the time to understand a community. And as you're saying, Jenny, be humble, but to learn and to take your cues. Sometimes I think leadership is thought of as a very individualistic endeavor. My career has been all over the place just because I'm following the lead of my community partners, just making sure that you understand how service to community can be instructive and fulfilling. And then also to kind of just have some imagination. We're really molded into a sort of like narrow scope of what we think is possible. So just having the ability to see outside of that box is something maybe my younger self was probably better at it even than I am now, because young people tend to actually have that vision.
Yes. How about you, Jenice?
Definitely being present, like being present for myself, being present in my body, but also just being present with my people and slowing down. I I got into the work and I ran and ran and ran, so much so that I ended up in the hospital. Definitely just honoring that, like, while my willingness, my care, my passion pushes me and into me, right? It feels like I don't mind. This is what I would like to be doing. It might not always match what my body is telling me that I need to be doing. And sometimes my body is telling me to go sit down.
Yeah, young people don't, and I'm not young anymore. I still feel young in my mind, but we don't like to slow down. We want to do everything and have it all done tomorrow. And patience is something that you earn over a lifetime, is what I say. So that the point of slowing down is really, really important. As I bring us to a close on this, we know that dismantling structural racism and building anti-racist health systems is hard work, and change has come slowly, particularly in this space around midwifery and birthing. The whole birthing conversation has always been institutional focus. So it can be hard and it can seem hard. What I'd like to hear from you, what gives you hope? What gives you hope during this time and this day? And I'm going to start with you, Jenice.
It gives me hope to be in community. I am a person that sits under my elders quite a bit, and that's just knowing that it's not a new issue, knowing that people have always been committed to change deeply gives me hope. My daughter is the most argumentative person about every issue that she confronts in her day-to-day life with others, and she challenges so many different narratives. So to see that she's just like picking up certain pieces and activating around them on her own really gives me hope for what the next generation may do.
That's beautiful. How about you, Sonya? What gives you hope?
Yeah, Janice, I like how you framed it, being in this intergenerational transfer of knowledge, and hopefully the young people that I work with, I think they've got it, So for me, it's been not just hopeful, but also sort of like nourishing and energizing to be able to work with young people. And that could be like kids in preschool, it can be kids in middle school, it can be young Navajo women who want to do research using indigenous methods. So I have hope for the next generation.
Fantastic. Jenny, what gives you hope?
Yeah, I'm seeing the movement. It's growing. It's slow, but it's growing. I see the folk who get it, who understand that this is justice work, that this is our fight for our liberation. There's birth justice, maternal justice, reproductive justice, economic justice, right? These pieces interwoven into getting to better healthcare outcomes and, better healthcare structures have me hopeful that maybe a couple of generations away, but we are on our way again. And I think we'll be okay if we can just hold the line and hold each other. That piece has really worked for us. We have really seen that the collective care is essential at this point. that it's not just self-care, but we're bringing each other to the same place, like sit down, sis. You, enough, right? And rest is definitely part of that for all of us. So I think we have a hope for a future.
Beautiful. That word, hold the line and hold each other, I think is a great point to close us out. A big thank you to Jenice, Jennie, and Sonya for sharing with us today. I'd also like to thank our listeners, both new and old. Don't forget to subscribe to the podcast to get notified when new episodes drop. We are available on all platforms, iTunes, Spotify, and Amazon Music. And as always, make sure to visit meetattheintersection.org for the latest events, conversations, and resources. The views expressed here do not necessarily reflect the views of the Robert Wood Johnson Foundation. The foundation does not support lobbying efforts, including any activities or communications referenced during this podcast.